Well, we have to take you to the Kotoka International Airport, where there is an ongoing interaction by the Ministry of Aviation and authorities at the Ghana Airport Company. Live now.
Key measures that we put in place to make sure that we do not import the virus into the nation. Once again, I'm happy to say that working with our Port Health and the Ministry of Health people, we managed to get the excellent testing system that the Honorable Minister just spoke about. That system, when it says you are positive, it means you have the virus. And as you heard, the accuracy is around 95%, 99 to 100%. But the next question was, how do we put in place the measures to make sure that it is convenient for passengers to go through the protocols, the processes, to get tested and then flow through the terminal building like they did before? Very soon we will show you images, not today, because we are still disinfecting the place and we cannot even take you around. But when someone arrives in Ghana, it is mandatory for any airline coming to Ghana to ensure that passengers have face masks on. But we know that some of our people will be coming from afar. If you are traveling from London, you probably travel like 6 hours. And so when you land at Kotoka Airport and you come through the passenger boarding bridge, when you get to the edge of entering the terminal building, we give you a fresh face mask. Under the responsibility and control of Port Health, there's a service provider who we are using to do all of this. So we give you the face mask and then you start going through the process. When you enter, you go to the far end of one side of our fingers at the upper arrival, and then you queue to go through a payment center. By the way, the testing is going to be at the expense of each passenger at a cost of $150. Now, one convenience that the Honorable Minister says talking about was the fact that there's no country that you can almost go through the terminal building like you used to do and still be able to get your results. And if you are negative and the health professional deem you to be without the virus to come into the country, it's Ghana. We are the first to do so. In Germany, it takes minimum 3 hours to even get that done. And so, like His Excellency indicated yesterday, it takes a maximum of 30 minutes for a particular passenger to go through the entire process, get to Port Health, and there at Port Health, that person is told, because the results will be ready, that he is negative, and therefore he can exit the terminal building and come into the country. If you are positive, like the Honorable Minister just said before me, you go through our medical protocols in the nation, and they'll deal with you. And so that system is so convenient that passengers will practically go through our terminal building with only a fraction of time added to what they used to do before. Okay. Now, the general measure that I spoke about includes the measure that anyone who comes into our facilities would have to wear a face mask. Within Ghana, you put in the measure that everyone should wear their face masks. I have to put mine off so that you can hear me. That's why I don't write it down. You do so at the departure hall. We will have people there to ensure that if you don't have the face mask, you cannot enter. It's not just going to be a sign. There will be enforcement at the frontage of our terminal building, at our departure terminal building. Also, Port Health is going to screen you. And in all our facilities, there will be markers on the floor to help users of the airport to social distance. So similarly, during the arrival process, in addition to all these fine processes that we've defined, there will be markers on the floor for people to follow and to safely social distance themselves to prevent the spread of the virus before the test comes out, and even after the test comes out, because there will be other agencies working within the terminal building. Other measures that we have also put in place is the provision of sanitizing stations at the entrance and at other vantage points throughout our facilities to make it easy for passengers and users of the airport to sanitize their hands so that they do not propagate the virus. We have also installed sling shells at every service point. I believe you will get the opportunity to take you through our facilities so that you can see this for yourself. In addition to the sanitizing stations at various vantage points, we also have sanitizers at each service point. So any point that a service provider, airport staff, BA's customer service will be to offer service to the traveling public or anyone who has business in a terminal building, there will be a sanitizer there to allow that individual to disinfect their hands before and after, if he so desires, if he so feels it is appropriate. In addition to that, there will be regular disinfection of our facilities to make sure that if there happens to be any virus somewhere, that virus will be killed. Now, to the general public, because social distancing is a good measure against the spread of the virus, we are going to be limiting the people that we would allow to enter our terminal building. And therefore, if you don't have any business in the terminal building, you will not be allowed entry. If you are traveling, or if you are accompanying somebody who is not that well and that person needs assistance, we would allow it. Other than that, you will not be allowed. Another measure is that we are not allowing pets to accompany their owners on flights anymore. And we also encourage online check-in to reduce the contacts at the airport. And last but not the least, passengers are advised to arrive at the airport at least 4 hours before their scheduled flight. I believe you understand it, because there will be various checks to make sure that you are following the various protocols to safeguard the spread of the virus. With this, I thank you very much for your patience and listening. Thank you.
That is Mr. Kwakwa. He is the acting managing director of the Ghana Airport Company Limited. As you heard him mention, you would have the opportunity to go through a test to be supervised by Port Health. Port Health is a unit or a department under the Ghana Health Service. I would like to invite Dr. Patrick Kumabwaje to speak briefly to the testing regime, and then specifically what happens or what is the case management protocol should somebody test positive. And just to clarify, Mr. Kwakwa is the substantive managing director at the Ghana Airport Company Limited. So, Dr. Baji.
Thank you very much. All honorable ministers, presidential advisor. I'll be brief and walk you through the protocols. The overarching objective of this is to reduce the transmission of the virus to passengers, travelers, and staff. And most importantly, to limit the importation of the virus into the country. So as has been mentioned, the general mandatory rules will be: one, mandatory face mask by all persons accessing the Kotoka International Airport, including the car parks, among other places. Enforcement of the social distancing protocols, and lastly, the mandatory hand hygiene, as using alcohol-based sanitizers to be able to wash your hands. For arriving passengers, as has been mentioned, you will need to come in with a negative PCR test taken at least at most 72 hours before you travel into the country. Ghanaians who travel for a meeting that returns in less than a week or within a week will be exempted from having to come in with a negative PCR test, and that's very important for people to know. There's also a digitized health declaration form that people can fill. You can even complete that before you arrive. That will tell us whether your risk level Are you sick? Have you had any situation? Where have you traveled to? So that allow the port health to be able to properly assess the risk that you are carrying in addition to your negative PCR test. The mandatory COVID-19 test on arrival, as been mentioned, will be done. And by the time you go through and get down to the port health before you go to immigration, your results will be there for them to be able to assess you to allow you in. I will get to when you are positive later. There are exemptions to the mandatory test. Children under 5 will not be tested because the risk is low and all the inconvenience that goes with it. Air crew will also not be subjected to the mandatory testing at the airport here, but they will have to follow their own protocols as far as the airline testing is concerned. For our departing passengers, as usual, the mandatory face masks should be observed. Compliance with the destination rules will come. So if there's a country that also requires a PCR test before you arrive, all that to be checked before you leave. And then all your temperatures, etc. In addition to the other things that the port health checks, vaccination protocols will all be checked through. Transit passengers who do not require to enter the country will not be subject to the mandatory test at the airport here, unless they are coming and entering Ghana before they leave. So basically, those are the things. But for the person who gets down there and is positive, the port health will now take over. They will walk you through, assist you through immigration so that to prevent any further contamination. There's a holding room that will be sent to, and then your bags will be put up. You'll be sent into, all of them will be sent to Ghana East Hospital for triaging, after which the necessary protocols, whether it's treatment, isolation, etc., will be instituted for all of them. So basically, these are the broad protocols in addition to all that has been mentioned at the airport. So thank you very much.
Thank you. That's Patrick Kuma Abwaje, Director General of the Ghana Health Service. Can I ask for the microphone to be brought to my right here, to the right here? Colleagues, this is the end of the first part of our brief. If you have a question, like we always do, please signal us and you step forward and raise your question, and then we can get you some answers. The second part of our brief will make some quick remarks on the Nigerian situation and take your questions as well. So if you have questions about the reopening of the international airport effective tomorrow morning, please step forward. Yes. That's fine. Is the microphone on? One moment, please.
Hello?
Yes, go ahead.
All right, good morning. My name is Lily Mohammed from JH1 TV. So you have outlined processes for Ghanaians departing. What of Ghanaians coming from other parts as well?
What about Ghanaians arriving?
Yes, and other passengers arriving in Ghana.
Okay, these protocols are for arrivals?
Yes.
Yes, so you are talking about departures rather. Okay, protocols for departure. Colleagues, any other questions? Are there any other takers who can just join up so that we are quick with the questions? Yes, come. Could you come this way?
Good morning, Honorable.
Morning.
My name is Abednego Asante. I work at Adop FM. As you know, maybe some question in tree. Honorable, first one is, sir, decision government and our president are taking. We are sure the Ghanaian public say, I will not play any chacha. Exposing the entire country to the pandemic. The second one is the cost involved. The month of the baby, so I say, so by texting on arrival now, how much is it going to cost?
I'm sorry, can I say $150? What kind of that? $150. So next question. Yeah, Kojo.
I'm Kojo from City News. I want to know the procedures for overflows. A lot of airlines will be, arriving from tomorrow onwards. What are the procedures for the overflows? And also, I also request that the media is taking on a tour of the facility that will receive passengers for testing. Thank you.
Very well. Yes, sir. Next question.
Yes, so 2 questions. PSA from JoyNews. PSA for JoyNews. So first is with the $150 you have to pay for the test. First of all, what went into it, and are we not afraid?
Come again. First of all,
what goes into that 150, and are we not afraid a bit that this could make our airport less competitive if others within the sub-region are charging much lesser? And with the second one, given that we have our air borders open, what's stopping us from the land and sea? What's the science explaining why they're still closed? Thank you.
Are there any other questions? I will comment on 2, and then I'll invite my colleagues to speak to the rest. There's a question about protocols for departure. So, Mr. Kwakwa, please stand by for that one. There's another question about procedures for overflow. Again, Mr. Kwakwa, I'll leave that one to you. Dr. Kuboy, I'll invite you to speak to the question of the justification for the $150 test, especially as there are suggestions that other countries are costing lower to test. Is there a difference in the testing mechanisms, and how that affects whether or not we will be competitive? But I'll quickly speak to the issue of the land and sea borders and Adom FM's question in Tree about whether or not this is risky. So you are aware that what the president does is to receive advice and examine the advice on our ability to mitigate the risk for everything we do. In the case of the international airport, the advice and the processes as have been outlined by the Ghana Health Service, Ghana Civil Aviation, or Ghana Airport Company Limited and the Aviation Ministry give him reason to believe that the risk is well mitigated and can be contained. Indeed, His Excellency the President himself did not just take their word for it, but he came here himself on a visit yesterday and was taking through the entire process. And there's that conviction that the various layers, including the fact that you do a negative PCR test before you board, provides us with some very significant comfort that the risk can be contained. Government continues to examine, for example, the testing regime in our neighboring countries and the levels of confidence we can have in those as part of measures to examine how the land borders and the sea borders can also be open. So at this stage, because we have confidence in how the international airport, its systems, and the risk levels can be managed, that is why this has happened. When we get to a point where we are confident that for the land borders, same can happen, a decision will be made there. You are aware, for example, in the case of students going to school, because we are not convinced that pre-tertiary, the kind of mechanisms that are being put in place will be able to protect our children. The president has elected to terminate the academic year and ask that next year the curriculum be adjusted to reflect that. So every decision he makes is based on a risk assessment of how well the risk can be contained. And if he's not convinced, he won't move there yet. That would be the reason. Adom FM question no. Enya chacha na yeto. Di aye ye bia no. Yedi gu nsaniani esusu se so ye bambo no ebeto sia na se begyina ne na so. Enu nti na wa hwe ye borders Burkina, Ivory Coast, Togo, ene Tema. Ye mie san se hono ye ndum pempenso bi a ye wo gidie se omo betumi aso bibia no. Mpanifo okoso wa hwe. So mohwe nsese a ya wo ho na se eto asum se betumi abo nyina ho ban a omampani betu ho anamo we dia wa ye na nye chacha na oto esan se o maye ho adwuma ma owo gidie se o betumi abo ho ban na enu ntina na wo bie na wanti o ma sem keke enra awia kwa anwumre ansana o bebie no ono ankasa ba ha de nani behwe e nanti mu ankasa hwe ti nye chacha to eniama ye de egu akwan mu no. So I want to invite Dr. Patrick Okoboy to speak to the question of the $150 justification, and then Mr. Kwakwa will speak to the protocols for departure and procedures for a possible overflow. And Mr. Kotoka, while at that, you may want to give us some numbers. When are you expecting your first flight? What are the numbers of passengers that you are expecting over a certain period? To give us a sense, perhaps you may even tell us how many additional people have you brought in here to help contain the situation?
Thank you very much. So, as a ministry and as stakeholders involved in COVID management, and of course, for that matter, the government, we were also very much interested in the cost of the test. We wanted to make sure that the cost of the test would not put unnecessary difficulty or burden on the passenger. Now, we quickly looked at what is being charged across the globe. So when you go to a place like Zimbabwe, you pay about $210 for the test. In China, you pay about $150 for the test. And they are doing PCR, which is a very good test that identifies the virus itself. And in China, after paying $150, you have to wait for about 6 hours average before you get results. When you go to Togo here, you pay about 150 euros, not dollars. In Benin, you are paying about 150 euros. In fact, I just got the figures for Nigeria. You pay about $130, and not only that, you have to go to a hotel and wait for results, which can be 1 or 2 nights. So if you are paying about $100 for the night, in all you are spending close to $300 for just making sure that you are safe of the virus or free of the virus. Now, so with all these considerations, remember that anyone coming to Ghana must have a negative PCR test. On the average in Europe, if you should enter a lab, not even the airport, to do a PCR test, you are looking at average 100 euros. So what do we do in Ghana, or how do we look at it? So we sat down and looked at a solution we had. Now, there is a good reason why a PCR test is the most preferred, or one of the gold standard. It's because it tells you that the virus is present. And not only that, but for academic purposes, it can give you some parts of the virus that over time, when you put together, you can have what we refer to as a complete genome, which is the whole map of the virus. Here at the airport, forgive me, it's not about academic research. We are interested in 2 things. The test must be very specific and sensitive, which means it must tell us that this guy has the virus if he has it. And if the test says it's negative, really, you pose no risk to Ghanaians. And we got a solution that was checked at Noguchi, checked with FDA, checked with Ghana Standards Board, and came out with a specificity and sensitivity rate of between 99 to 100%. Now, secondly, we also were interested very much in the time, the turnaround time, how long it takes to get the results. And after going through a lot of testing, we had a minimum of 12 minutes, maximum of 30 minutes. And with these 2 indicators, we now had to decide whether $150 of having the 2 most important requirements met is reasonable or not. And when we considered other things, we thought that comparing this figure to others around and what you would have spent, I think let me take my time to speak about this. Before this reopening, we had evacuation special flights coming to Ghana. Any passenger who got on board actually paid for 2 weeks of hotel bills before coming to Ghana. And if you are paying an average of, let's say, even $70 a night, you have to multiply $70 by 14 days. The cost far overwhelms what you charge for, the test we are doing right now. Secondly, if we should keep you here for 6 hours, for the other test regimes that take 6 hours, it will pose a risk of congestion at the airport, which in itself will serve as an incubation chamber for possibly a sharing of the virus amongst passengers. So the factors tell us that it is actually proper or prudent to go with this regime. Thirdly, remember that when Ghana first quarantined travelers in this country, and we picked over 100 and so cases, we actually tested them twice. And each PCR test we did cost an average $70 to $100. So Ghana spent close to $200 on one person to make sure that the virus is not brought to Ghanaians. And so for the passenger to pay $150, which is less than what we paid, and we fed them as well, I think it is a very good bargaining. If you want to come to Ghana, we as a government are interested in you coming, but we don't want you to come here with a virus. And by the way, nothing is more expensive than getting a virus, because it can lead to a critical illness and can lead to death as well. And when we start comparing the prices, I believe you agree that to pay $150 and keep Ghanaians safe, it is worth doing that. And it's going to be borne by the passenger. I think this is important. The cost is going to be borne by the passenger and not the state, not the taxpayer. And I believe after all the considerations, we were good to go. We even are looking at, out of the 150, some percentage coming to Ghana Airport Company Limited, the civil aviation, the port health, because this involves a lot of logistics accumulation and all that. So I am convinced that this is worth it. Thank you very much.
Okay, thank you. I'll take the overflow question first. In putting the solution in place, we looked at the maximum number of passengers that we can receive here within a period of time, and we use 1.5 hours. And the total number of passengers, based on the airlines that could come here and the maximum capacity of those airlines, we calculated 1,200 passengers. So our challenge was that we have to put in place a solution that could offer the convenience that I discussed before. That is, people should get in, we test them with a very accurate system so that they can exit the airport to encourage people to come to Ghana to drive our economy. It was not an easy task, but let's do the numbers here. In the solution that you'll see in the future, we have 70 sample taking positions. So meaning there will be 70 people in booths, nicely designed, built on the upper arrival concourse. It takes about, in our test, it took about maximum 20 seconds to take the sample. And so you can imagine the number of samples that can be taken. Let's use 30 seconds. 30 seconds means every minute, one station can take 2 samples. So 2 samples times 70 stations, 140 in a minute. So 140 times 60 minutes, way beyond the 1,200 people. Are you following? Are you following my argument? Even 140 times 10 is 1,400. So 140 per minute times 60 for the hour comes way above the 1,200 threshold. And so the sample taking will not be the bottleneck. How about the actual testing? We have 80 machines. Each machine can process 6 tests within 12 to 15 minutes. So I'll use the 15 minutes for my calculation. It means every 15 minutes we can perform 480 tests. So in the hour, times 4. Once again, more than 1,200. Meanwhile, the 1,200 that I quoted is over a 90-minute period. That is a 1.5 hour period. So these 2 activities that could limit our capacity to test people, we have more capacity than we need. I have to go back and explain that the 30 minutes that His Excellency gave yesterday includes the time that somebody enters our terminal building, he puts his mask on, He goes through the process of queuing to join the line at the payment center. Gets his payment done, gets his sample taken, goes down to Port Health to interact with the Port Health person to know whether he could come into the nation or whether he should be handed over to Port Health. 30 minutes. So it was not the actual test. And that's why I said the testing capacity we have we have more than enough. Yes, there are. Our departure protocols includes the mandatory wearing of face masks, mandatory sanitizing of hands at the entrance of the terminal building, and mandatory temperature checks, all by Port Health and Ghana Airport staff at the entrance. And then in the terminal building as well, in the departure terminal building too, once again, we have all the markings to help people to social distance, and there will be enforcers. We have an enforcement team between Ghana Airports Company and Ghana Health Services to ensure that these protocols that we put in place are going to be observed. No, you don't need to take any test before you go. I believe the Honorable Deputy Minister for Health explained that if the destination country has that protocol, then you'll be required to take the test before we allow you to go. But Ghana is not putting that burden on its citizens to get the test done before they leave, at least for now. No. I'm talking about our if you want, our peakest period, over a 1.5 hour period. That is the peak. Based on the capacity of the airline, that would arrive within that time. Yeah. And there will be. And you will entertain any service provider who may want to rent some of our offices to offer that service. It's not a monopoly.
So, colleagues, just to be clear, depending on the requirements of the country that you are going into, that is what will determine whether or not you require